Welcome to the Roanoke Presents from Print to Podcast, the Retirement Series, a spin-off podcast series by our sister publication, Retire VA. We launched this podcast due to the interest and popularity of retirement living in Virginia's Blue Ridge, wanting to showcase the options you have at your fingertips thanks to local businesses ready to help with your questions and needs. Whether you're on the verge of retirement, enthusiastically embracing this phase of life, or helping family and friends through their own retirement planning, Retire VA is tailored for you. Today's episode focuses on hospice care, thanks to expert Aaron Housh, the CEO of Good Samaritan Hospice. Good Sam has been the only nonprofit, community-based hospice serving Southwest Virginia since 1992, providing the highest quality care with the most options, expertise, support, and compassion. Good Sam was also the first hospice in the Roanoke Valley to obtain Medicare and Medicaid certification and offer the full range of hospice services to people needing this special kind of care. Hi, Aaron. Thank you so much for being on From Print to Podcast today.
Thank you.
Really glad to have you. Really glad to have you and talk about all things for our retirement podcast series. And so just for listeners, Aaron is the third CEO in Good Sam's history, and his entire career has been devoted to end-of-life care, where you have gained extensive experience in hospice leadership and operations. He was born and raised in a small town in Central Texas, has a wife and 3 children, and we are now so glad to call you home in Roanoke. We're so glad to have you here.
Oh, and I'm glad to be in Roanoke. We love it here.
Good. We're going to talk about that later, because we were talking about all things food before we sat down, because that's obviously what I can do all day. But right now we're going to talk about hospice, which is a really important topic, especially when it comes to planning your retirement, end of life, things like that. Not only for yourself in the later stages of life, but of course for your family and friends that you're helping out through that process. So I'm curious about, when is it time to get hospice involved?
You know, that's a great question. I think it's a fairly easy answer, but it's complicated when you're in that place, right?
Right. It's a very difficult, hard to think about. Your heart kind of, squeezes a little bit thinking about that.
Yeah, and I think the best answer is whenever someone is diagnosed with an advanced illness. It can be a lot of things, but an illness that we know we're not going to be seeking cure for, right? Mm-hmm. And we may be looking at comfort or those kind of things. I think that's the best time to really reach out and connect to a hospice and palliative care provider. Mm-hmm. For us, if you're eligible for hospice, you do have to be certified in hospice, and there's criteria for that. You often hear if a disease takes its normal course and you have 6 months or less of life, that's really the appropriate time for hospice. That's really hard to know.
Mm-hmm. Right, because sometimes there's a pop where they might feel like they feel better, and suddenly they feel like that's extended.
Right. And some people, I think when someone's diagnosed with cancer and those kind of disease, that's a little bit easier to understand than, say, heart disease.
Right.
Or pulmonary disease and those kind of dementia, Alzheimer's. Mm-hmm. But I think when someone is diagnosed with one of those advanced illnesses, connecting with a provider, connecting with Good Sam to say, hey, this is what's going on. Can somebody come and talk to me about it? We have the hospice program that really does focus on patients that are closer, have a advanced illness, terminal illness that's 6 months or less. Mm-hmm. We also have palliative care where we can come in much earlier and help families navigate those decisions and make those decisions at the appropriate time.
It's really wonderful to have your services here because, again, there are so many questions that everybody has along the way. And, of course, having an expert to be able to answer those questions in a really caring, considerate way is really important to make you feel like you're doing the right thing by your family member or whoever it is.
Well, and I think it's, people see that hospice decision as scary, right? Yeah. They also see that as my loved one is dying. We wait till that last minute before we want to get hospice involved. Mm-hmm. When if you really want to get the full array of the best service from hospice, we want to get you much farther up that disease process than right at the end.
It's an interesting point, too.
I mean, we have social workers, chaplains, volunteers, nurse aides, nurses, physician. We have this entire team to help navigate that. And so I always say when people are at that place where the time for hospice is, has come, mm-hmm. it's really about how do you want that end of your life to be? Because the truth is, with the patients that we serve, you're not going to change that trajectory of your disease, but you can change how you choose to live that last part of it.
That's so cute. That's so cute. What an important point, because it's sort of like you're talking about, my mother and I joke all the time because, she's getting ready to retire and then we're thinking about those next stages. And and she'll make a joke about, when I'm not around anymore. And I'm very in denial. I'm not going to talk about it. My mom's going to live forever. That's the end of it. But you're correct. And that at some point I'm going to have to consider that. And the sooner, the better. And for her to even be involved in that conversation could be really important too, to note so that I understand her expectations of what she wants out of what you can offer her.
And so many of those patients, as they're sort of moving through that journey, if they don't choose hospice, oftentimes they are in and out of the emergency room in the hospital. I mean, and it's just not a place that you can have a lot of quality sometimes, And our goal is that, the last portion of someone's life, and I'm going to say last 18 months to 2 years, that it has as much quality as it possibly can have. And what is quality? I mean, that's what people have to really decide. Some people, based upon their disease, want to fight until the very end. And we support that decision. We want to be supportive of that. But most people wouldn't choose to be sitting in the ER in hospitalization, back and forth to doctors, when the end result is really going to be the same. So it's really, to me, it's about choosing how you want to live that portion of your life, and really educating people and helping to have those conversations so that they can plan early. I think this is sort of going a different direction, but I always encourage people, talk about these things long before you're faced with them.
Don't deny it like me. Yeah.
Yeah. I mean, and just talk about it with your mom and say, let's talk about this. What do you really want?
Right.
And so when we get to those decisions, and if you're making them, I recently, lost my grandmother, and we had to make some decisions towards the end of her life. But it was fairly easy to make those decisions because we had a lot of conversations about what she wanted.
Right.
Right. And so we were faced with this decision about putting a feeding tube and doing some things. And it was an easy decision for us to say, we know what she wants.
Yeah.
And we can honor that. When you're making that decision and you don't know, there's a heavy burden on your shoulders, right? And that's sort of hard to carry. And so we always encourage people, talk about these things long before you're faced with them. Talk about these things early in a diagnosis. And like I said, it doesn't have to be, we care for patients with all kinds of diagnoses, but having these conversations so that you can honor someone's wishes and make the best decisions. Most people, if you look at studies, most people want to die at home, and they want, to be surrounded by their family and their loved ones, and they want to have that experience. Right. And talking through that, what does that mean? It really leads to better outcomes in the end.
And I would think there's a lot of relief in a family member's demeanor, personality, character when their loved one finally passes, but they know they've done all the things that, they wanted from them. Yeah. Well, I'm thinking about the information that we're talking about. And so I'm curious about, hospice. There's a lot of, some people want to talk about it and some people don't. And so they don't always have all the information that they need or they want. And so I'm curious about myth and fact of hospice and what that looks like, how you explain that to people who are asking questions for it.
Yeah, there's so many myths out there that impact how people view hospice.
Sure.
And I could think of so many. One of those is, I think the most basic is people think you have to be dying, and I say, really at the end of your life within the last couple of days in order to be eligible for hospice or benefit from hospice. And that is just not true. At Good Sam, our average length of stay for a patient is somewhere in the 70-day range. So our average patient is on our service about 70 days. But patients can be on our service for, a significant amount of time. And we do see those patients that are declining, but we also have those patients that are for very, very short lengths of, stay, and they're not on our service very long. So I think the big thing is knowing as you face advanced illness, that is the time to reach out and understand what options are available to you. It's not just talking to us at Good Sam or our teams, it's also talking to your family and your physician.
That's a very good point that, you have many of the answers, but not necessarily all of them that help put that all together.
And sometimes I think it's, with providers and your care team is to say, I understand my diagnosis, I understand, what's going on, but let's talk about the reality of what this means for me. Let's talk about that. I even think it's an avoided topic sometime in medical care.
I believe that.
Sure. It's an avoided topic, and that's not, it's not negative towards the provider. It's a hard conversation to have.
Well, in their industry, like their one goal is to care for the patient, keep them alive, right? Like that's their goal. And so you're there to kind of help transition that.
Right. But if you can just say, hey, we need to have a conversation about this. I want to make the best decisions from here until the end of my life, but I need you to be honest with me. I need you to be honest about what you really think is the trajectory of this disease and what kind of quality, that I can have at this point. And having those conversations early is always the best. So I think that's a big one. Myth is you have to be, right there at the end of your life in order to be eligible for hospice, and that's not true. And in fact, in order to get the best experience in hospice, the more time you have in hospice, the better. You get to develop relationships with our team, which really provides that holistic approach to care. Like I said, we have spiritual care, we have social work, and our social workers and that team can help do a lot of things to prepare not just the patient for that, but also the family. In hospice, our unit of care is the patient and their family. So how do we support that family and help prepare them? I mean, if you've ever lost someone in your life, which most of us have, it just changes the whole reality, right?
Yes.
And the more that we can prepare for that, the better. And sometimes that's getting things in line so that you know how to pay the bills, right? And that you know how to do this and that. Things that but it's just helping to facilitate that so you can be as prepared as you possibly can. And I do believe, I've been in hospice my entire career, 20 plus years. I do believe that we can create a good death. And I think that death for us is focused on two things. The patient, is the patient comfortable? All of those things. But also for the family, because the family now has to live without this person that they love. And if the experience of that death is good, I think the ability to cope and move forward gets much easier. I know that for myself. Like I said, unfortunately in January, I lost my grandmother, and she had an exceptional death. And my family's ability to process that has been somewhat remarkable to me. But we also weren't carrying this grief that was a little bit different from a really bad experience at time of death, or No,
I think that's interesting. Yeah, no, it's great, and I think that's actually, you're talking about myth and fact, and so I think a myth is that you're only helping the patient, right? And so the fact is, it's not just about the patient. I think that's beautiful to think that you're really helping these families find a healthy, easier way to move forward with their lives. Not move on, because you'll never forget that person, but to move on with their life so that they're not quite so grieving.
I think another myth that we see or that we hear pretty often is, I'm going to say two things. Number one, you have to have a DNR, a do not resuscitate, to be eligible for hospice. That's not true. We certainly believe when patients have advanced illness and they have a terminal illness, that it's likely in their best interest to have a do not resuscitate, because of the likelihood of resuscitation is very low. It's very low in most circumstances, but very low with someone who has a complicated disease process. However, that decision is still the patient and the families, and we honor that. And so if somebody doesn't have that, you do not have to have that to be eligible for hospice.
That's interesting.
Now, we're going to talk about that with you, and we're going to continue to have conversations about it, because we want what's best for our patient and family in the end. But you don't have to have that. The other thing is, I hear this pretty often. It's like, oh, you have to go off of everything in order to be on hospice. Like, they discontinue all medication. And that's not true. We will work with the patient and family. We want you to stay on the medication that helps you and helps you be most comfortable. And we have a physician and a whole team that will help facilitate that. I think a common misconception around what we do inside hospices, we do use comfort medications, and those medications sometimes can be scary by definition, right? We use morphine and those kind of things. I think morphine has I don't even want to call it it sort of sometimes gets a bad reputation.
Yeah, we hear it on TV a lot for the spooky, scary stuff.
Right,
and, yeah.
right. And so it's like, I think a lot of our patients and families, when they come on, it's like, oh, we don't want morphine because we're not ready for the end. When morphine is just a phenomenal drug to help with comfort. We not only use it for pain, we use it for shortness of breath. It's actually one of the most effective things if someone's having shortness of breath. So there's a lot of reasons to use it, but people say, I don't want to get addicted. I don't want my loved one to be addicted. And it's really a myth that people have this misunderstanding about it, because the truth is, if you need it, right? If you need it and you're at this phase in your life and you need it to control your shortness of breath or your pain, then you're not going to become addicted. I think you become addicted when you're taking the medication and you don't need it, or you don't need it anymore.
Perfect sense, yep.
But it's something that people really struggle with. It's like, oh, I'm going to go on hospice and they're going to put me on morphine and this sort of comfort regimen, and that will facilitate the end of my life. And that's not true at all. We believe that in hospice that we do not prolong or hasten death. That's our goal. It's to support people in that moment and help them to be as comfortable as they possibly can. We want our patients to be alert and oriented so that they can have quality time with their family. But we also don't want them to be suffering from pain and symptoms that we can manage, right?
Right.
And sometimes that's a hard balance. I mean, it just depends on the patient and what's going on with them.
What you do, is so important and so, thank you for you and your entire staff and your team and what you're doing. And I'm thinking about, you mentioned your staff and how they work together, all these little puzzle pieces that come together to form this way of life that you're going to help them move on. And so Good Sam, what you're doing is really incredible work. And you've listed several things that already kind of sound wonderful, but what are other ways that Good Sam is so set apart from other hospice care opportunities?
Well, I think I would say first and foremost, just by structure, and I love to say this because, what really makes us different, in my opinion, is that we are owned by this community. We are this community's hospice. We are sort of, I always say sort of born and raised in this community, but we're also governed by this community. So we have an all-volunteer board of directors that serves as our governing body. In order to be a part of that, they have to live in this area. And so I always say that's the one thing that makes us different. Community-based hospices across the nation, that's what is our differentiating factor. We are this community's hospice. We are owned by this community, and therefore respond to the needs of this community. We also, which we'll talk about in a minute, we also invest in this community. When we need to grow our services, when we know that there's a need in the community, we respond to the needs of this community, and we reinvest any of our resources back here in the Roanoke and New River Valleys. And so, to me, that's the it's the differentiator. Some of it is just, we are always looking at how do we make the end-of-life experience the best it possibly can be for our patients and families. And then we respond to that. And so we are investing, in my opinion, in our care very differently. And there's a lot of hospices to choose from across the region, for-profit, there's all kinds. And I think when people need to make that decision, the heart of who we are is based on the people that live here. And I think that's the differentiating factor for me. I
love that. We're cheerleaders of Roanoke, obviously, here at the Roanoker. Yeah. But I love that, you're helping put things back into the business economy, right? The local economy benefits from the work that you do. But I especially love that the community you're so focused on them. That's really, that's something you don't see very often, that your higher power is not to a corporation, it's to the people that you serve. Right. And that's really amazing.
And to people that live, work, and are a part of this community. And I've always chose to be in community-based hospice. I could not imagine if I was reporting to someone, I'm just making this up, in Dallas, that doesn't know us, doesn't know this region. And we've done I think Good Sam, over the course of our entire 30-plus years of work across this region, we have always responded to those needs in the community. I'll give you a couple of examples. I know that leads into one thing we probably want to talk about is with the work that we're doing with the new Center for Caring. But when I joined Good Sam in 2019, we did an internal strategic plan. We met with, at the time we had about 100 staff members. I think I met with 97 of the 100 staff members, and we talked about what are the needs of this community. What do you see when you're caring for patients and families? What are the gaps in care?
Those are some really amazing questions that not every CEO is going to ask their employees.
Yeah, and we came up with this beautiful strategic plan. One of them was focused on how do we serve this community better by expanding our service. And so we actually let all of our staff, we had 6 things that came to surface during that, and they all got to make 3 votes. And the things that got the most votes were what we included in the strategic plan to start looking at developing plans around, can we do it, does it make sense, all that stuff. And the first one of those was palliative care. That was the number one vote from our staff to say there's patients that fall through the gaps, right? They are not ready for hospice. Sometimes many patients in palliative care are hospice eligible and appropriate, but they're not ready for a number of reasons. Sometimes it's an emotional kind of, they're not ready for that kind of thing. Sometimes for patients, it is that they're also still seeking aggressive treatment, for a number of reasons. Cancer is an easy one to talk about, but maybe someone's still getting chemo and radiation. They're not yet ready for hospice. Maybe they're not even eligible for hospice at this point. But gosh, they're having a lot of pain and symptoms and those kind of things. They can get into our palliative care program, and we can help with that, work with their physician. We have nurse practitioners and PAs that work in that program that are going out. So, but anyway, the team said, gosh, we need palliative care. There's these people that are not yet ready for hospice, but they are living with advanced illness and it's not being managed well. We need a program to manage that. And so we, in 2020, in the middle of COVID, sort of a crazy
Which
time
is a
period.
whole nother, we could talk about that all day, because I was literally thinking, gosh, you did all of this in the middle of the pandemic. Anyway.
Yeah,
gosh.
we kicked off that program in the middle of the pandemic, really on a leap of faith, but knowing it's what our community needs. And so we did that, and it's actually super. It has just grown and grown and grown. We have more than 300 patients in that program right now. We have 3 full-time nurse practitioners, a PA who's doing consults at Lewis Gale Hospital. That program is just really taking off because it's a gap. It's a gap that our staff identified.
Well,
right?
and that's what I was going to say. It is amazing that this idea spurred from your Q&A essentially with your own employees, and so you invested in them, and now they're invested into this program that they had a hand in creating. That's something that is important, not just as a patient, but as an employee. Your teammates know that they can rely on you to listen to them and to hear what they have to say.
Well, and I'll be honest. I moved here at the end of 2018, and so we're having these conversations in 19, and I didn't know the Roanoke Valley well. I didn't know the New River Valley well. I was dependent on the people that lived and worked here, and many of our people that had lived here their whole lives, right? And then the second thing that they voted on inside of that was to expand into hospice inpatient care. That is probably most easily defined as a hospice house. And so those were the top 2 things that they felt if we were going to expand, these are needs inside of this community. What do we do when we have a patient at hospice and they're at home and they are experiencing a pain and symptom that we have done everything, but we cannot get under control? Right now, we partner with our local hospitals to manage that, both with Corellia and Lewis Gale, and we do the absolute best that we can. But the acute care environment is not set up for that best end-of-life care experience, right? You also have, not every physician or provider that's in those facilities are trained in hospice and palliative medicine, right? And all those things. So we knew we wanted to do that. So back in 2019, at the same time we started that look at palliative care, we started to look at, can we do hospice inpatient care? What are the costs? What are all those kind of things? Could we, if we opened a hospice house, could we fill the beds? And so we went through that whole process to do studies and understand that, to make sure that we were making a good decision on behalf of the community first, but the organization second, right? And we decided, the board voted, I think it was probably back in 2020, to really start moving forward with that project. So today, we actually sit a few months from the opening of the first freestanding hospice inpatient facility in Southwest Virginia.
Wow.
So we're really, really excited about that.
And you know how healthcare is in Southwest Virginia. People in the rural areas will come for that. They will want to support that and be part of that because they don't necessarily have that opportunity in their sort of more rural region.
Yeah, we were recently giving a tour of our facility. We're still in a capital campaign to help raise the funds for the facility. We had a $5 million capital campaign, and we're $3.2 million on the way there. So we've made a lot of progress.
Yeah.
I mean, we've got about 1.8. So we've been giving lots of tours because one thing I've learned, I came from the hospice I worked at previously was in North Carolina. And in North Carolina, for a lack of a better way to say it, there's a hospice house almost in every county. It's like at every corner there's a hospice house. You come to Virginia, there's none.
Really?
But we were given a tour the other day to some people from Goodwill and had a great tour with them. But the lady was talking to us and she was telling us an experience that she had, I believe, with a family member. And that family member really needed hospice inpatient care at the end of life. And they went to West Virginia for that care.
Wow.
Beckley, West Virginia has a wonderful facility of which I worked at for 5 years.
Right. But what a shame that they can't be right here where they live
Right.
and play and everything.
The closest hospice inpatient facility to here is either to go to Beckley, West Virginia, or to go down to North Carolina, either to Winston-Salem or Greensboro. And so those are the closest places. If you want freestanding hospice inpatient care, you can go to Northern Virginia, but the closest is really out of state, which is such an unfortunate thing.
Right.
So when we talk about hospice inpatient care, or say hospice house, it's people don't really understand it. So we spend a lot of time taking people over, explaining the care that we'll provide at this facility. So we are building a 16-bed facility. Many people ask why 16 beds.
That was my next question. How'd you know?
Well, it's the maximum allowable in the state of Virginia.
Okay, all right.
You know, as you probably understand, every healthcare facility and organization is under a license, and those licenses have all these rules and regulations. And one of those regulations is that if you are greater than 16 beds in the state of Virginia, you have to license as a hospital. If you license at a hospital, it's a whole different,
Right.
you know, you have to go through a certificate of need process and all that. So that's the maximum allowable in the state of Virginia at one location and one address.
I can't imagine it's going to be difficult to fill those 16 spaces.
Yeah, I mean, you know, I guess the answer is we don't really know. Based upon some of the studies that we've looked at and the things that we're doing in preparation, we think we'll be able to have those beds full. And
But you're fully prepared for it no matter what happens.
yeah,
I mean,
and at this point we are fully prepared for that. But it's, you know, and we'll offer 3 levels of care. I like for people to understand hospice inpatient care in a hospice house. I like to describe it as the hospice hospital. You know, so we will be providing a higher level of hospice care than you can provide in the home. You know, without going into great detail, that's sort of called general inpatient care. Right now, if somebody needs that higher level of care, we can send them to the hospital and admit them at that, and we still stay a part of the care. But in this facility, I like to say they sort of come to our home, and they're able to stay in our home. We've designed this facility to be as home-like as possible.
I love that you're coming to your home.
Yeah, you're coming to our home, and we have these 16 beds. It's sort of done in two wings, and the 8 rooms are sort of around a family space that is shared. It's a beautiful space, but it's designed truly to look just like a home. If you go into the family space, which is right outside of the patient room, you have a kitchen, a living room, a little kids area, and it's sort of a shared space, but it's designed to be we want it to be your home away from home. Where do people want to be at the end of life? At home. So if they can't be at home, we sort of want to take home to them.
That's really beautiful.
And so, you know, we're really excited. So we'll have that highest level of care. So say somebody's at home and they have pain, symptoms. I mean, we have patients sometimes that have uncontrolled nausea or vomiting, and and we've had our physician go to their home. We've had everything that we can do. We can bring them into our home. We'll have a physician do rounds every day. We'll have RNs, LPNs, CNAs, you know, that are there to help care for them. We'll have a social worker to help facilitate that, and spiritual care as well. But, you know, to really do intensive pain and symptom management inside of that facility. And then, you know, we'll also offer respite care there. I think it's an important portion of what we do. If if a family needs a break for a number of reasons, that could just be, it could just be they're exhausted.
Right. 24/7 care is.
If you are caring for someone around the clock, 24 hours a day, it is exhausting. I had the honor, not to go back to it, of caring for my grandmother back in January. So I had 6 or 7 days where I was caring for her at home previous to her death. I was exhausted.
And you're aware of every facet of what happens with hospice. I mean, imagine, I got no idea, and I just can't imagine.
Day 6, and she had passed away. I think I slept for 2 days.
I have heard that because
I was
were caring for them.
So exhausted. And I wanted to be with her throughout that process, so I was sleeping pretty much on the floor beside her bed so I could be there. But I was just exhausted, and that was 6 days. It really helped as even a hospice provider, right, administrator, to help me to understand the really difficult path of caregiving. And some of these families have been caregiving for years, months, and they're exhausted. And so we can take patients at this facility for up to 5 days to give the family a break.
Right.
Sometimes that's for, they want to take a little vacation. They just need a break, or maybe they need to get to their own doctor's appointments or have a procedure themselves. And so we can take patients at the facility in respite care. So.
That's wonderful, because it's not always, sometimes you're not always lucky to have a family or siblings to help you as your parent or your grandparent passes. And so if you were the sole care, provider, like that's a lot of weight on your shoulders. And so I think that's a really wonderful option that they have to be able to take a breath for themselves.
Yeah, and we will offer some residential care as well, but our focus will really be on we are licensed. We'll be licensed as a hospice inpatient facility. I also think it's important for people to know we are really licensed to be a short-term care facility. We're not licensed as long-term care. So for someone to sort of come and live there for a long period of time, we will have patients that come to the facility and stay longer periods of time. But the focus of the building is really short-term care. And if someone needs truly long-term care, we want to work with our wonderful partners across this valley. There are some phenomenal long-term care facilities and partners here, senior living communities. And there are partners. And if someone needs that longer length of care, then we'll partner with them and help them to find that in those places. But this... Going back to our facility, I don't think people will understand it sometimes until they experience it. I will say this, my whole career, I joined the first hospice, community-based hospice I ever worked with was in Kentucky, in a town called Berea, Kentucky. And this was 20 plus years ago, we were building a hospice house when I joined that team.
Wow.
And we're doing a capital campaign.
Now 20 years later.
And now 20 years later, but every hospice that I've had the honor to work with have all had a hospice inpatient facility. It's very interesting to come to Roanoke, which is the largest area I've ever lived in as far as population, and not have a hospice house.
That is curious.
It's. I think I know. I don't think I know. I have an opinion why that is. Hospice in the state of Virginia is different than a lot of other states that I've worked in. I've always worked in states that have certificate of need for hospice. So in order to start a hospice or open a hospice, you have to go through a certificate of need office and prove that there's a need to be met. That doesn't exist in Virginia. So it's very easy to open up a hospice in Virginia. So there's a lot of hospice there's a lot of hospices across the region. I think we have 10 to 13 here in the Roanoke Valley. When that happens, it's really hard for one hospice to have enough resources to be able to invest in these extra services. Does that make sense?
Absolutely. Yep.
And so you just don't see it across the state of Virginia. Like I said, you go to Northern Virginia, you'll see some hospice inpatient facilities there, but you just don't see them, at that. So I actually got here, and I think I was about a month into my work year, and I'm like, how do we do this without a hospice house? Like when we have a patient in crisis. When we have a patient in crisis and we're trying to figure out what to do, we're not in control of it. We're not.
Right.
It's with our partners who help us and do a great job, and we love. But it's not always in line with the hospice mission. It's not always in line with the care that we're training our staff to provide. And so I mean, it was probably month 2 that I said, we really have to do this. And I think that it's something that's important for this region.
I'm a believer in Kismet. I think it's meant to be that you came at the right time to be able to bring your team together, discuss this, and think about how you move forward with offering this to people in our area. I mean, and for you to have the experience that you do and help build this from the ground up, completely from scratch. I mean, that's not an easy task, certainly. But with your background and your experience, we're able to have that now available to us. So I think that's really amazing.
Well, it has been my honor. It truly has been my honor. And I've never done it from the ground up quite like this. I mean, it's been...
You're learning a lot as you go, I guess.
I will say it has been a labor of love.
Yeah.
Because, I've been a part of campaigns, I've been a part of building, but never ultimately responsible in the way that I have been here. And, but it really has been a labor of love. I mean, we at Good Sam, this has been a dream of 32 years. When Good Sam started 32 years ago, my predecessor, Sue Ranson, a part of the initial documents plan was, number 1, to start a home-based hospice. Number 2, take pediatric patients. Number 3, open a hospice house. And that plan at that time was that they would do that within, I think, the first 24 months to 36 months, 2 to 3 years. And so that was always a part of our founding, is that we want this level of care to be available to people in this region, right, in this part of Southwest Virginia. And then 32 years later, here we are being able to fulfill that dream. And so that's been a great honor for me. Sue, who was my predecessor, our first nurse, and was with us from day one. She's a great friend, colleague. She's now on our board. And so she is being able to be a part of the fulfillment of that dream.
And that's so wonderful, too, that she's had such a deep part of this and a deeper understanding of, again, not just the company, but the region. So any questions you have, maybe she's able to help guide some of those things. That's a wonderful team effort on everybody's part.
Yeah, and we've been able to do great things. I mean, we wanted, when we started this project, because we're this community's hospice, we wanted to do what? We wanted to build this with the community. And so we've been able to do that in so many great ways. Number 1, through support. I mean, $3.2 million towards this campaign. It's been phenomenal. But we've also kept this as local as we possibly could. And so, G&H Construction in Salem is our contract and construction company. Has been a wonderful partner. SFCS, which is downtown Roanoke, has been our architect. And so we've just tried to do everything that we can as a part of this community, because this community is what keeps us moving forward, right? And we want to keep this moving. So it's the whole experience has been a great experience, and it's connected me inside the community.
Sure. Well, I mean, we're taking care of you in this instance and helping build this, and that's specifically because you can help take care of us after that when it's done and ready.
Yeah, I was at the grocery store this weekend and bumped into 3 people that are part of the construction team that are working. I mean, they're doing different pieces of it. And
well, Aaron, I think you're Roanoke famous now. So.
Well, I don't know about that. But I will say this: I love living here in the Roanoke Valley, and when we moved here, it was tough. I had not young children. I mean, one had just started in high school, and I really didn't think they were going to forgive me for moving them.
It's a transition for sure.
But I can tell you, we love it here. Our family loves it here, and I've said this a couple of times, but this is now my home.
Well, it's a wonderful seg into kind of wrapping up our conversation. And especially it's so exciting actually to me that this is one of the biggest, if not the biggest area you've ever lived in, because, you don't hear that very often. You hear people who moved here, they're coming from a bigger area and they want a smaller place. And so I love that this is the big city to you. I'm from Danville. Roanoke was the big city to me growing up. I knew that I wanted to come to Roanoke as New York City, But in thinking about what you and your family do, because you're now part of the community, as I always ask every guest who's on here, where are you guys living and playing and eating? Like, where do you guys love to go while you're here in our region?
Yeah. So, I mean, we actually we live on, I call it the Salem side. I mean, we have a Salem address. We live in Roanoke County out towards Catawba.
Okay.
So we live really close. We live up behind Carvin's Cove in that area. So
beautiful.
It's a beautiful place, and there's all kinds of things to do. Right down the road, you can go biking and hiking and go out. It's just a great place to be. I think Roanoke is a great place for those activities if you love them.
Hopefully your kids are into that, some of it.
They are.
Good.
They are. My kids are getting a little bit older. I have a son in college now, But my youngest son goes to Glenver High School, and we love Glenver and big fans of that. But I was telling you, I think Roanoke just has a wide variety of great places to eat and play, right?
Yeah, you can't be bored here. I refuse to believe that statement.
Yeah. And even 5 years ago, this is a funny statement for me, but I really love some of the breweries around here, that we can sort of go. We go with friends and family, and we go and we play cornhole and we play games and we sit outside.
And there's only more now. Like now you have even more great ones to pick from.
Yeah, I mean, some have food, some have food trucks, and sometimes we meet at the back of Old Salem Brewery in Salem, and we have dinner and then go home.
It's a perfect day.
And just, if it's a beautiful day and they have a good food truck, that's what we sort of do. So we love sort of doing that and participating in that. But there's so much good food across the valley. And I was telling you a little bit earlier, during COVID, I love Asian food. It's probably my favorite. I will tell you, Thai food is my absolute favorite food. To the point that I took a trip to Thailand just to eat the food.
I respect that.
Back in 2018, and I wanted to eat street food, and I did, and it was a phenomenal experience. So, but during COVID, a lot of the Asian restaurants they were pickup only and that kind of thing. So we ended up over here on Electric Road at Ichiban, who we had this great connection with the guy who runs it there named Jerry. But I will say they're opening a new Ichiban over at Batatat.
I saw that recently.
Right off
That's
of the
exciting.
interstate there, and we ate there this week in their soft opening, and it was phenomenal. Actually had a sushi roll that made me a little uncomfortable, but it actually had Wagyu beef on top.
I want to eat that.
Raw Wagyu beef.
Interesting.
And it was phenomenal.
Yeah, I want to eat that.
But I think I love to go downtown Roanoke and eat. There's such a variety of food down there, and I think what I love about it is that we have, sort of high-end food and high-end restaurants and food trucks that you can go grab quick food, and it's much more inexpensive, and all of it's great.
Yeah.
And so I will tell you, we love to eat across the valley, and you could find me sort of going all across the valley to do that.
I can't wait to bump into you at any of these places.
If I find a new, on social media or Facebook or something, there's a new restaurant shared, I'm probably there within the first day or two that it opens.
I love it. That's another great way to give back to your community. You're supporting a local restaurant, and they probably need it in that moment of new opening. I mean, that's great.
Yeah. When we're always looking, there's a little place I follow online that sort of highlights the things across Roanoke, and I actually follow it, and then I follow them to different restaurants sometimes. But there's a little new little taco place. I don't know if it's new down in Salem. I think it's called Taco Coronado, something like that. It's a little tiny little place. But we ended up there after I saw it online, and they have the best tortilla chips I've ever eaten. They make them fresh and bring them to you.
Oh, well, I'll eat the whole basket before anything even
I did. But I'm just saying there's such, and what I love about, this is last thing I'll say about eating, because I love it.
We could talk about it all day.
But what I love about it is that people that work in those industries and people that own these restaurants, they are customer people. They love people. They want to serve people. And, if you go in, get to know those people, your experience becomes so much better. And then you're also supporting people in this community who work really hard. Right. Owning a restaurant, that is not a job that I would want to do, right? But it's 7 days a week, 24 hours a day. My job's probably that way too. But.
Well, it's all the things that you were saying, I was like, sounds a little bit like your job, where, we come to give back to you have a hardworking team. You have hardworking people who are ready to give back to this community and help the people who need their services. Yeah. So, that's everything that you're saying, it can be reflected right back on Good Sam and all the things that you're doing.
I want to say one last thing.
Sure.
Because I know you asked me this, what's the differentiating factor? And I want to say this. We are only as good as the people that work for us. And what makes us great and what makes us special is our people. The people that want to do hospice are special people. But the people that want to do that in the environment that's community-based nonprofit, their heart are in the right place, and they are what makes us different. And I can't say enough. We've grown, and we really have a large staff now. I think we have 137 employees. But
friends and neighbors, listeners, those are your friends and neighbors working hard.
They are working hard, but they are phenomenal people, and they are what makes Good Sam Good Sam. We had this campaign a few years ago that it was called "I Am Good Sam." We are Good Sam, and we did that because it's our people that make us great, but it's our people that are a part of this community, and so we are this community's hospice in so many different ways, and so we're proud to be that. We're proud to be that, and I think as we open this facility, as we've expanded into palliative care, I think we're also the hospice and palliative care leader. We are the leader in helping to facilitate, to make sure that when a patient faces the end of their life, they get all the care and service that they need to make it the best experience for them and their loved ones.
Well, those are really important words from a CEO, no less, but in general, but especially coming from somebody who knows his team, knows the company, and knows now the region, and knows kind of what we're looking for. So thank you for the really, truly important work that you and your team do. I don't speak for the entire community, but I will today, but thank you. It's really important work, and we need you here. So, and I'm excited to hear more about the home and all the opportunities that you're going to be able to offer our community in the future too. So that's really great. Thank you so much for being on our show today.
Thank you.
Listeners, again, you've been learning more about hospice care in our second episode of our retirement series. Thanks again so very much to Good Samaritan Hospice CEO Aaron Housh, again, for his insight into hospice, including what it entails, the important services Good Sam provides, and how we can better prepare ourselves, family, and friends for the next stage of care in our lives. And of course, again, most importantly, thank you for being there for our community in times when we need it the very most. Thank you.
Thank you.
Absolutely. And so, listeners, again, remember this is just the beginning of our Retire VA series. For more engaging discussions on retirement living, please make sure to subscribe to our podcast for regular updates. You can stay informed, inspired, and equipped with valuable insights. And for more information on Good Sam, you can visit their website at www.goodsam.care.